Okay, great, thank you. I think we're waiting on a couple more people here, right? I think I saw Greg stick his face in.
Lori, it looks like you're quite the baseball fan, huh?
Oh, you know what? And that's because, again, after I spilled, my grandmother was the 105-year-old that was the Cleveland Indians throughout the pitch and was there for the World Series when they did the commercial with Al Roker. So she was a massive fan. So this is actually kind of, it was her room before she passed. And so it's all her memorabilia in here. Yeah. Thank you. Good morning, Greg.
Good morning. Sorry, I've been running around like a chicken with my head cut off. But here I am.
Did you still copy on your computer?
No, I didn't do that, but
then you're in good shape.
Yeah.
So it sounds like we're already streaming. So do we want to go ahead and, when you're ready, Greg, with we go ahead and, yeah, we'll start. Sure. We'll open it up.
Okay, so we'll kick this off with a roll call. Trey Addison is here. Greg Sini is here. Bonnie.
I'm here.
Here. Lori.
Here.
Stevick Rust. Jennifer Rost.
Here.
And Tina Hotchwalt.
Here.
And Viren Hamajan is not here.
Right. And
so everybody but one is here, so that's good. Did anybody have an opportunity to review the meeting minutes from last week?
Yes.
And can I get an approval for that so that I can forward that to the state and they can put that out to general public?
Yeah, motion to approve the minutes.
Okay. Second. Who seconded that?
Jen.
Jen, okay. All right. And then I think that's all we need to do in order to kick things forward. So I don't know, Trey or Lori, do you want to?
Well, Trey, do you want to, I can start by just reviewing then where we left off at our last meeting, which was to break into dyads here and work on those 3 objectives that we identified in terms of a goal, consolidated goal, and then how we will do a measurable to know if we are advancing those goals forward. And then we agreed that at the conclusion of finalizing those 3 goals and getting them into a nice, neat, tight buckets, we would then look to integrate those into the 4th bucket, which is the state's plan. And so with that, the way that we broke this down, Trey and I took the first objective, which I think it might be most useful that we'll go ahead and share our screens, and then each dyad can go ahead and report off on the findings and conclusions that you both came up with. So if we kick ours off here, Trey, maybe you could do the screen share and we'll start launching into the factors that we identified.
Yep, 1 second, should be sharing, open share Trey. All right, let me know if you can see my screen.
I can see it.
All right.
Everybody else?
Yep.
Okay.
Yeah. Yes.
So the objective that we identified as our starting point as we consolidated all of those diamond categories, the first objective was to identify new and best practices to support early detection, prevention, and progressive interventions going forward. And we started off with the question of what factors impact this early detection and progression of, or the identification of progressive interventions for Ohioans with dementia. And so these are kind of the subcategories. And as we go through, if there are things that you all certainly would add to this or want us to delete from it, let's keep this as a workable document. So at the conclusion today, we'll have maybe more elements filled in on the skeleton of the outline. So one of the factors that we identified was certainly location. recognizing that, you know, when we look at the data, the single best indicator of healthcare, when we look at disparity and diversity, is zip code, where folks are located. And within that element is identified access to healthcare, access to transportation, physician and nurse training around screening for early detection and prevention, building a statewide infrastructure that supports early detection, tapping into state university health systems that could also augment the process, memory assessment clinics, ensuring that there is a systematic focus statewide, and culturally competent public awareness campaigns targeted at diverse communities. So let me pause there and see, Trey, if there's anything you want to add to that, or anybody else from the group here may want to add to that subcategory.
No, I think, you know, one of the things in looking at it in the community sense, I think is really starting to zero in on, you know, where we need to focus at the community level. Obviously, there is, you know, various disparities and or just overall educational opportunities at the community level. And that's in tandem and partnership, I believe, with the Department of Public Health, of course, who has the ability to scale up and scale out public awareness campaigns. There is also dollars at the federal level that can flow to states who put together robust Alzheimer's and dementia related campaigns. So there is a funding stream there. There is a precedent there. So yes, to Lori's point, here are just a handful of areas where we can zero in on and focus.
Is there anything that we have missed, just again, and as we're building the skeleton here, that pops up for anybody? I did notice as I looked at all three of our objective work products that we created, you're going to see a theme and a trend there too. And it sounds like for all of us, it's about coming up with a systematic way to assess. We all know, and any of us who work in this field, we know it's not a structured process, and where I know that we could certainly move the needle. So. All right, then without any other comments around that subcategory, then we moved into healthy living, which certainly overlaps with communities, but looking at where education might play a role in prevention and self-management. So around nutrition, brain health, physical activities, and where we're going to be sending in that educational component at each potential touch point with a person who comes into contact, either in the community setting or in a healthcare setting. Which then, of course, dovetails directly into primary care screening, which, again, my bias in all this is where we really absolutely need to do a much better job in moving the needle. We know that most all of our seniors first identify with issues with their memory or changes in cognition at their primary care docs. And when we look at the data, still around 68% of those cases are missed or underdiagnosed. And so I think that one of the areas we identified is making a more standardized healthcare screening process, looking at home and community-based support programs, looking at home care workforce training and caregiver support, building in a component to do that dovetails into the screening that identifies comorbid mental health concerns. We know that those are comorbid overlaps, but they are also the fallout of a diagnosis of dementia that often is not addressed or identified as a problem. You know, we focus, and I know that most of our healthcare professionals focus on the cognitive elements related to dementia, but many of our caregivers, both professional and family, will talk about that comorbid mental health component or mental health symptoms that makes it the most difficult for them to be able to provide care. So I think in terms of screening, that we need to do a better job as healthcare providers in educating folks around that comorbid component. And then codifying physician education in early detection and diagnosis of Alzheimer's and dementia, all under the rubric right here of primary care screening. I know we have a geriatrician in here. Is there anything, I know with your subspecialty, certainly you're doing all of those things, but is there anything else that you think we should be adding in terms of working with our primary care colleagues?
No, I mean, and part of that may come into, I mean, not only the screening, but And you can't take that out of time and reimbursement issues around those things, which is a much larger scope maybe than is workable here. But I think that we need to at least provide that language of support for the need for kind of billing, coding, timing of visits change that's needed.
And one question to the physician education, early Texas diagnosis. Even I think that I want to say Medicare came out with, or they have a code as it relates to screening. I have to go back and see. This was something we worked on a few years ago. But is that kind of your point of if they just really there's educational opportunities on what the code is and how to use the code for that? Is that kind of what you're alluding to? Because I want to capture that for sure.
Yes.
Got it.
Yeah, that's a great question, Trey, because I think that at least what I see in our hospital setting is many docs don't know that it exists. And then the ones who do know that it exists, many of them will say, but it just doesn't fall under my purview. That will go over to our geriatric specialists.